Hi, I'm Victoria Austin and I'm the Chief Exec of the Global Disability Innovation Hub. We're based here on Queen Elizabeth Olympic Park and we're proud to be part of the legacy from London 2012. It was here in East London that London hosted the 2012 Olympic and Paralympic Games. London 2012 was the most successful Paralympic Games ever, with more athletes from more countries than ever before and the most inclusive Olympic park ever designed. We're proud that the Global Disability Innovation Hub grew out of that legacy, and our partners, including the University College London, where we're based just behind me, have supported us to continue our work. Global Disability Innovation Hub now works in over 33 countries around the world, many of those in the Commonwealth, and we have more than 40 projects across a profile of £50 million. We're working hard to ensure that the disability innovation commitments of London 2012 continue and that other countries, other governments and other organisations can help also. What's really important to us is that disability innovation continues to drive a fairer world. We want to see change where disabled people can be included in all aspects. It includes political participation as well as access to jobs and employment. In order to support that, we work with organisations like the World Health Organization, UNICEF and the Clinton Access Initiative, and also more local organisations in the countries where we work to further change. We are two things: an academic research centre where we work with the world's best thinkers to design new technologies and policies, and we're also a community interest company, a non-profit that works for change and impact. I'm really proud that at the moment we're delivering a £40 million programme for the FCDO in the UK. That means we're investing in access to assistive technology in almost 30 countries. This is really important. By assistive technology, I mean access to wheelchairs, hearing aids, eyeglasses, walking sticks, crutches and prosthetics. There are nearly 1 billion people in the world right now that need access to these technologies, and 9 out of 10 of them do not have access. Without this 90% gaining access to assistive technology, we have literally no hope of achieving the Sustainable Development Goals. And we know that disabled people have been further hurt by COVID than others, in terms of stigma and access to the long-term care they need, but also in terms of the debilitating effect of the virus itself. Now is the time to make disability inclusion a priority again, and we're working really hard to make that happen. One of the ways we were able to affect change here in London is by designing an Olympic park that is accessible and inclusive for all. That means we designed inclusive design standards that had to be applied when we built this place. We worked with a group of disabled people from the local area, and they helped us design the Olympic Park in a way that enabled people to get around, whether they used a wheelchair, a guide dog, eyeglasses, or whether they couldn't hear. And so, as you walk around the Olympic Park now, you'll see lots of features: accessible benches, outside lifts, but also really simple things like ramps and level access that means everyone can enjoy the park freely and equally, and without the need to ask others for help. Now, we know this isn't always possible, and we know that sometimes budgets don't allow. In terms of access to assistive technology, thinking about the 9 out of 10 people that don't have access at the moment, we're working really hard to try and close that gap. With the World Health Organization and Clinton Health Access Initiative, we're addressing the way that systems and health organisations can change. That means supporting governments to know which ATs they're buying and how they can do better to equip their population with access to assistive technology. It also means we're trying to find out what the return on investment is so that government ministers in countries where resources are limited can make good choices. Working with local communities in countries like Sierra Leone, we're able to drive change from the bottom up. We're working in slum settlements with people who are the poorest communities to find out what community-led innovation is taking place, and we're helping to accelerate that. In Kenya, we have an acceleration programme for 80 entrepreneurs, and we're investing now in the second round of entrepreneurs. The first was a guy who was successful in producing an electric wheelchair that was appropriate to the terrain in Nairobi. He's going on to get further investment and further his business now. And the final thing we're doing at the moment is looking at whether impact investment can work for access to AT. Through a £4 million fund, we're able to address the needs of the market and support entrepreneurs to bring their ideas to scale. Innovation is a really important part of addressing the disability gap. And we know that where we listen to disabled people and understand what's needed, and then support entrepreneurs and innovators, many of those are people with disabilities themselves, to bring their products to market, we really can affect change. We know that promoting disability inclusion can be really tough. And we know that it's important to work with other people, even when you don't agree with them about everything. We know from our work in London and around the world that when trying to make sure that buildings and spaces and places are designed accessibly, it's necessary to start with asking people with disabilities in that area what they want and need. We also know that it's vital to get the commitment to disability inclusion in right at the beginning. And that means before the building's been designed or before the policy's been written. We also know, and this is particularly important because our founding chair was Lord Chris Holmes, who is a British parliamentarian and Paralympian, who continues to help and guide us in the direction of our work, that having leadership by people with disabilities can be really powerful. Our board is made up of disabled people from 3 continents, and many of our staff, we have disabilities too. And so what's really vital is ensuring that people with disabilities have a voice in the policy-making process. We've done this in lots of ways. We've done this through virtual meetings, we've done this through focus groups and community-level activity, we've done it through big UN agencies and engagement. But we know that it's our role to help translate all of that into something which can affect change. And so we try to produce tools and guidance so that it's helpful for others too. More than 15% of the people in our world are people with disabilities. In order to drive forward all of our goals, we must make sure these people are included within the work that we do, the governments we lead, and the countries we govern. For me, the most important thing about the revolution in technology we currently have is that it can enable change. Sometimes it can enable change more cheaply, but only if we're able to advocate at the right times, draw broad partnerships and get the people on board that we need to. As leaders, our parliamentarians are really well placed to do this. At the Global Disability Innovation Hub, we'll keep working hard for change. We'll keep driving disability innovation for a fairer world. We really hope you'll join us.